Hello, everyone, and welcome to another episode of Innova Chats. Today, I'm really excited to have the CEO of one of the strongest advocacy groups here in the US that's advocating for the long-term care industry and for rehab, Cynthia Morton. Cynthia is the CEO of ADVION, being CEO now for quite a few years, and we're going to have a candid conversation about the regulatory environment as we see it right now in long-term care and what it means for rehab providers. There's a lot of good stuff here with changes that are happening with the new administration. We're going to talk subjects about like the big beautiful bill, and we're also going to talk about advocacy and what can you do in this profession to help move forward through advocacy and how you can get involved with that. So Cynthia, welcome to the show. Maybe you could tell us a little bit about yourself. I'm always fascinated about your story and how you ended up advocating for our industry.
Yeah, thank you, Louis, and thank you so much to Innova Chats and you for inviting me here today. It's really a pleasure to be here and talk about these subjects that are near and dear to my heart. I've spent almost the majority of my career on long-term care, but I came to this job kind of an interesting journey. I started out really working in politics. I worked for a couple of Virginia governors way back in the day, right out of college, and then held a job with a law firm that lobbied for the Nursing Home Association. In fact, I met my predecessor in this job back when he had that job down in Virginia. And so I kind of say I cut my teeth on nursing home, mostly reimbursement issues. We were lobbying the state legislature down in Virginia. And then a later job I held was working for the Virginia Medicaid Agency, and I worked for the director. I was his special assistant. And in that role, I got to see and kind of dip my toes into every issue going on in Medicaid. You know, how we set the nursing home reimbursement, which was not always favorable to the nursing homes. We were moving every population we could, except seniors, into managed Medicaid. So this was the 90s. So I got a really early view on managed Medicaid plans and how that goes up and down, as well as understanding eligibility and just kind of the nuts and bolts of Medicaid. And that really helped me understand kind of that part of long-term care because I took all of that experience and ACA, American Healthcare Association here in DC, they then hired me when my husband and I got married and decided to move up to DC. They hired me in 1999 to be a nursing home lobbyist. And I had not worked on Capitol Hill here in DC, which most lobbyists have, but I had state experience. I knew how to lobby from doing the state issues, as well as one little key issue that we had at the Virginia Medicaid Agency was handling closures of nursing homes when they had bad surveys. So I knew what a 2567 was. I'd actually held one. I knew that whole scenario and that unfortunate scenario. And that really helped, I think, give me some credibility here in DC. So I lobbied every issue that ACA lobbies on, from Medicare to Medicaid to VA, provider taxes, everything. And in those days, it was kind of interesting. In those days, Congress, and I shouldn't say it out loud because I might give them the idea, CMS would give them Part A payment update, in the summer. In fact, that'll be coming out soon, here in this late summer. Congress would attempt to take some of that payment update away. We've not seen that. We've not seen that in the almost 15 years I've been here at Advion, but that was something we had to always defend against. And then my predecessor here, then in ASL, now Advion, he retired and he asked me if I'd come interview with the board. And the board hired me to run an ASL, and we had this wonderful rebranding as Advion. Just it's been about 4 years. So I'm almost I'll be beginning my 15th year here soon.
Wow.
And yeah, it's gone by really fast. And my mandate from the organization was to up the advocacy, to really make our advocacy program more robust. And I think we've done that. There's always more to do. There's always more to go. But that's been a key feature of what I've worked on here, really amplifying and making the members' voice heard and make it effective, both with Congress and CMS.
Great. Wow, that's so fascinating. So there's so many directions I could take this right now, right? So I'm gonna kind of be like a little bit all over the place. So I hope that's okay with you, you know.
I'll follow you.
But first of all, thank you for your service, NASL,
Oh,
now ADVION, right? Um, I'm part of this
you're
organization. I'm part of the board, and your leadership, throughout these 15 years have been nothing but exceptional. So I want to thank you, for really, helping our industry drive the change that we need, in Washington to continue to provide and deliver service for the patients that, all of us, all of our providers see. I'm really curious, what is the life in the day of a
a
lobbyist?
lobbyist.
Right? Yeah, so
Ooh,
you
yeah.
wake up in the morning, right? And even before, Advion, right? You were lobbying, right, for the
Hmm.
nursing home
Yes.
industry.
Yes.
What does that day look like?
I'll give you bits and pieces, and it's different every day. Oftentimes you're having meetings mostly with staff down on the Hill. In the old days, you went down to Capitol Hill. These days, it's a mixture of in-person meetings, which are always preferred, and sometimes we do Zoom meetings. So it's one-on-one with staff often, and you're trying to convince them to have their boss co-sponsor a bill, or you're fighting against an issue. So you're going in that 30-minute, 20-minute meeting and trying to tell them why they should not support a particular issue. It's usually a frank conversation. I like to tell people that in this town, you're really known, all your reputation is all you have. And I'm really very well known as an honest broker, and I've always conducted myself that way. And I think that really helps with your credibility because that's really all you have when you're going down there and you're really trying to present your case to staffers. And then sometimes you're talking to members of Congress. Sometimes the communication is coming from the Hill. We could get an email from a committee staffer or maybe a staffer of an office, and they want to know a question, they usually want to know right then. And that's kind of a drop everything, get that question answered kind of activity. Um, Sometimes it's working in coalitions. We may pull together with other therapy organizations and have a kind of a show and tell day down on Capitol Hill where maybe we're showing equipment or we're doing a briefing and that kind of thing. You want to get staffers and members of Congress to attend. So, what do you do when you want people to come to something? You serve food, right? So we may have a free Chick-fil-A lunch, and might do it between 12 and 2. And there'd be a lot of calls to prep for something like that. Other times we might spend our day just here in the office drafting a letter that we're going to send to Capitol Hill on a particular issue. Maybe we're endorsing a bill. So we're going to write that letter. We might circulate it among our members for some input. And then we use software that can shoot that letter out to every health legislative assistant so that they review it. The staff really make a lot of recommendations. They make all the recommendations for their boss. So there's a lot of lobbyist to staff communication. In the old days, we were always trying to get staff to go to lunch with us, but we can't buy their lunch anymore, except these, widely attended events like a free briefing where we provide a Chick-fil-A lunch, which is very desired on Capitol Hill. Other times we're having phone calls, Zoom calls with other organizations in coalition, trying to plot strategy. Okay, you know, I've got relationships with these 6 offices. You've got relationships with these 5 offices, and so we're gonna split this target group up, and we're going to go in there and have meetings and with those staff and talk to them about a bill or an issue. And sometimes it's talking to CMS. We're doing lobbying there. Just today, I had a meeting with 3 CMS staffers regarding the MDS specs And we've been working with them over time on a better schedule for them to release those specs earlier and during a time when IT vendors and other people who need to review those specs get them timely. So advocacy can take many forms, but there's a lot of examples there of what we
Yeah.
might do in a day.
That's very, very interesting. So for some of you guys listeners that are wondering, what exactly does a lobbyist do, right, in our industry? That's a great,
Yeah.
great picture that you just painted.
You're smoozing with people, but what you're really doing is knowing you're taking the time to know that audience, that particular office. Is it a Republican or Democrat? Are they on a committee of jurisdiction for your issue? So is that staffer going to be a little more savvy on your
Right.
particular issue? And then knowing how to um, prepare a compelling argument that meets that audience.
Yeah,
You might come across a staffer who doesn't know the difference between
that's right.
Medicaid and Medicare,
That's
or you
right.
might come across someone who really knows Part B really well.
Mhm.
So
Mhm.
you have
Right.
to adapt in prepping for that meeting and also adapt on the fly. Because they might bring in somebody else, and so now you have a two-person audience there. So
Yeah. Yeah.
I wanted to just dig deeper a little bit on those
Yeah.
meetings and just provide that little
Yeah.
color.
Oh, that's actually, I can totally relate to what you just said, because now we'll get into this a little bit later on in the conversation in terms of, like, what can we do as uh, you know wherever you are in the industry, whether you're on the provider side or on the tech side, right? Like, when we join ADVION, there is that training, right? It's like,
Mhm.
how do you lobby? How do you talk to your representatives, at the Hill, whether it's Senate or the House of Representatives? And it's really all about, like, understanding where they're coming from too, right? Like, what issues are they trying to push, right? And how much do they know about our industry? So when I think about lobbying too, especially after, really being involved with Advion, is our job is to really educate those members in Congress, in the Hill, about the issues that are affecting the lives of the patients that we serve, right?
Yes.
Because you can meet with somebody that's really, really up to date, like you said, with all the regulatory changes and how that's impacting providers and patients, versus somebody that's really more inclined to talk about, energy, or the budget, right? You know, and they don't know much about healthcare at all. So I think a big part of advocating is really educating those constituents too.
It is. And in both of those examples you gave, maybe a staffer who, yeah, doesn't know, I'll just say they don't know the Medicaid or Medicare program, but you've got to go in and talk to them. Or
Right.
the staffer that, say, knows Part B and all its complexities really, really well. One thing that those two do have in common is that they're not sitting there thinking, gee, what do the members of Avion need? Um, in other words, it's incumbent upon us, the board, the members of Avion, the staff, all of us working together to take our message to both of those audiences, to both of those examples. Because if those two staffers, just as using as an example, if they don't know we exist and that we have a policy agenda and we have needs, they'll never they'll never think about us and they'll never act on anything in our best interest.
That's right.
So no matter who we're talking to,
Mhm.
it is our responsibility
Mhm.
to do those advocacy efforts that
Right.
you're talking about so
Mhm.
that we can act for our patients, act for our own business needs,
Mhm.
keep ourselves in business so we can
Right.
keep serving, those patients.
Yeah, yeah, exactly, exactly. So I don't necessarily see it as, even in the old days when you could actually take staffers to lunch and or dinner as a smoothie, right? But, like, you have to connect, right? Just like with
Have to
anybody else that
connect.
you're trying to work with, is that you have to connect with those folks in the Hill, right? With the staffers, with the congressman, with the senator, right? How do you
Yes.
make that connection so you could really help them understand what your cause is, your mission, and what you're advocating for, right? Because they have
Yes.
so many things. One of the things that I've learned, just being part of Advion, is, my goodness, these staffers, there's so much on their plate, and they're going, like, meeting after meeting after meeting, right? It's like every 15, 20 minutes they have another meeting, whether it's not just healthcare, right? I mean, it's just every issue under the sun.
Yes,
And
they
it's
might
hard
have,
for them too, you know?
it is. They may have responsibility for healthcare, post office,
Right.
VA, and agriculture, you know?
Exactly. Right. So yeah, so you have to come from that place of understanding too, I think, when you meet with some of the staffers. And um, what is your favorite restaurant in Washington?
Oh, my favorite is a
We talk
restaurant
about
called,
food, right? So, talk
yes,
about going to
love talking
lunch.
about food.
So there's some
Uh,
great restaurants in Washington. So,
yes, I love Tosca, which is an Italian
okay.
restaurant down kind of in the 12th and F. Been
Okay.
there a long time, barely made it through the pandemic. But it's a little, it's not quite, it's kind of high style Italian, and it's
Okay.
very, very good.
What's it called again? I don't think I've ever been there.
Tosca,
Tasca.
Tosca. Yeah.
Okay. All right. So there you go, Tasca. Free publicity here. Just, completely spontaneous publicity.
Yes,
So
great
that's good to
question.
know. Well, that leads me then to, can you tell us a little bit about the mission and the vision for Advion? And for those members, there might be some listeners on the show that don't know much about Advion, or maybe they've never heard about Advion, right?
Sure.
And yeah, what does Advion do? And what is the mission? And tell us a little bit about the organization.
Sure, love to do that. We're a trade group. What does that mean? We're a group of businesses, of companies. Companies are our members. They pay annual dues to Advion, and in return, we do really many, many things for them, but they kind of distill down to three key things. We're providing education, business intelligence. Every day, almost every day, we're pumping out information analysis coming from the Hill, coming from CMS. You don't need to know everything that both of those entities are doing or other parts of the government. So we distill down what you need to know. We provide it context, analyze it for you. Right now, we're in the midst of analyzing the Part B physician fee schedule. And I mean, some of the codes, some are looking okay, some are not looking good. And we're performing that analysis right now, and we will send a memo, a multi-page memo out to our members that they can use to understand how the codes will change for 2026, so it can inform their budgeting as they go this fall. It can inform any contracts that they might have with clients, and so that they understand how their bread and butter reimbursement could be changing. Plus, we can advocate for change based on the analysis that we do. So it's that business intelligence, that education. Then we do, as you've talked about, a lot of advocacy. We're your voice. And our mission here, our aim here is really to increase patient care and to work together as companies to get to a place where we have better public policy that enables us to provide high and higher and higher and higher quality care. That could be through different regulations, through interoperability, through more reimbursement. So we're really about the patient, but we've got to be able to stay in business to to keep treating that patient. So we've got to advocate for policy that can help us keep treating and keep ourselves in business. And then probably the third piece of what this organization does for members is what we call collaboration or coopetition,
Oh,
networking.
for
It's
this.
getting to know others in the industry. Maybe you want to know what your competitors are doing, or maybe you just want to know what your peers are doing on a particular issue. You want to meet them, you want to have a relationship with them. But we go beyond that, and that's what we kind of call coopetition. We have a lot of cooperation, a lot of collaboration. We had a group of our members put together a guide on remote monitoring recently, and we shared that out from their point of view, and we shared that out with all members. So it's kind of a neat place where competitors and non-competitors, and I don't mean to emphasize competitors too much, our members say they leave their competitive sword at the door when they walk into an Advion room or a Zoom call. But it's a special place in our society where groups of similar companies can come together, work for the better good, and that's really what we're about.
Yeah. Yeah, and I can certainly attest to the competition. I like that word. I learned a new word today, this
Yes,
competition, right? Because
yes,
it's true. You have companies that are competing either where it's the provider side, right? It could be a contract therapy company or, maybe a skilled nursing home, chain
Yes.
or a health IT company, right? A technology provider too. But being part of Advia now for the past few years, it's very true that at the end of the day, we're all there when we go to the meetings or we get on calls. It's to really advance the industry and move it forward, right?
Forward.
So we're
Yes.
all having the same issues, right? As an IT company with Innova Health, we're trying to help the providers that are delivering care, right? We got to understand their issues, right? But when we go to forums like this, we get to really, really understand the trends, right?
Yes.
And the problems at a large scale. And that competition allows, I think, providers, executives to really help each other out, right? So that we can provide better care to patients at the end of the day.
Absolutely. And, we do have a board and I want to thank you for your service on the board. But beyond your
But
service on the board, you've been a long-standing, dedicated member for many years and thank you for that. And I wanted to throw in what the word AVION is.
yes,
Yeah, it's not an acronym. It's a word. Now it's a made-up word, but it's a mashup actually of two words, advocate and champion. And we just took pieces of those two words, advocate and champion. And where did those words, to make Avion, where did those words come
I love
from?
that.
Yeah, when we were undertaking some focus groups, when we were wanting to rebrand a little bit, those two words kept popping up. You're an advocate for us, and you champion our issues. And so, the PR people kind of put those two together, and it really stuck. And it's a wonderful story that I like to tell.
Yeah, yeah, I love that name, by the way. And actually, I was not aware of the mashup of
Yes.
advocate and champion. I love that. I think it's a lot better than NASL. I know NASL was was NASL for a while, but I love Avion, the branding. You guys have done a fantastic job with that. So tell us what's going on now.
Okay.
What is the climate in Washington now, and what are the issues that Advion is focusing on and working on that are affecting providers or poised to affect providers if we don't do anything about it?
Sure. A couple of different modes kind of at the moment. The first mode I would say would be kind of reaction and now moving into an implementation mode from after the passage of that huge bill, the One Big Beautiful Bill Act. That's its official name.
Right.
The president signed it on July 4th. So there's, I think, shock and a little bit of reaction because it went fast. It went through the system faster than we really anticipated. It has a couple of wins in it for our sector, which I could mention, go through real quick if you'd like me
Yeah,
to,
yeah,
as
absolutely.
well as some downsides. Okay.
Yeah,
The
let's get into that.
the three wins, uh, two of the wins are really more direct to our nursing home friends, but they will impact us because we're in the same sector. The first is a delay of CMS's mandatory nurse staffing requirements that were in finalized regulation, delays that regulation for 10 years, which effectively kills it. So that was the number one priority of Leading Age and
Mhm,
ACA. And so they got that. And we were supporting them all along the way. We met with
mhm,
CBO for them and all kinds of different things. So that's
mhm.
great. That's in there.
Yes.
The second piece is a little more weedy, but I'll keep it high level. It's called a provider tax. And taxing a provider sounds negative, right? But in this case, it's a positive because Medicaid law allows states to tax nursing homes, hospitals, and managed care organizations. And when the state taxes those, let's just call it they tax the nursing homes,
Mhm.
the state then kind of aggregates that money that they've taxed and received from the nursing homes. They can kind of deem it Medicaid funds, and then they can obtain federal matching funds for that pot of money. And now they kind of have roughly double the money than what they had when they collected the tax from nursing homes. They can then redistribute funds to the nursing homes. And this is a very simplified version of how it works, but it's legal, it's in law. It's done in 37 states, have a nursing home provider tax. And it's really undertaken as a way to maximize federal money with less state funds. Because the Medicaid program is a state federal match program. So it's a way to obtain more extra federal match and redistribute that as part of the reimbursement rate to the state, to the nursing homes in the state. So that, when you're helping to increase that Medicaid reimbursement rate for nursing homes or hospitals or managed care, that's good for all of us who have nursing homes as clients. Well, Congress wanted to clamp down on that. They don't like that. They call it a funding scheme. They think it's negative. And so Congress was trying to walk that back a bit. And that would be a way to save more Medicaid money because that was a big piece of the bill. But the nursing homes prevailed. And so it was a win for them that they got a
nursing homes were
carve-out.
advocating for this.
Yes. Yes.
This is very counterintuitive to me because they're advocating to actually get taxed.
Have a tax. Yes. Yes. That's why I said it sounds like kind of the
I
opposite.
don't know what it is.
Right. But it's in this case, the tax is a way to
come back.
pull down the extra federal money without state match and pump up the reimbursement rate, which is lagging in a lot of states. So Congress did restrict it for hospitals and managed care organizations, but not nursing homes. So that was a big win when so many states are depending on that funding mechanism. The third win is a little more direct to us, and that was at the last minute, Congress put in a 2.5%, I'll call it addition, to the Part B physician fee schedule. We were going to be, we've been in this pattern for the last 5 years of Congress giving provider relief, an extra boost to the conversion factor to mitigate reductions that CMS finalizes. So Congress gave us 2.5% for 2026. There's been no relief for 2025, and we don't anticipate any when Congress comes back for the rest of the year. So that 2.5% was a big win. We'd had a little money in, and then it dropped out in the Senate, and then we're all advocating for it to come back, and the House put it back in. Which is great. That's a big win. We're counting our pennies at this point on the fee schedule, right? So we need every bit of relief and assistance we can get. And that applies to everyone who bills. It's an addition to the conversion factor. So it applies to all providers that bill under the fee schedule. Now,
so that's the good, right?
That's a good. So those are three good things.
Those are three good things. Now, before you go into the bad news, right?
Yes.
I am still a little bit baffled about the tax one.
Okay, let's go back to that. Sure.
So we're in a sense, we're saying, okay, it's a provider tax, but that money is going to come back as a result of high reimbursement rates, right? But how about nursing homes that are like tied up in cash, right? Like cash flow is tight a lot of times, right? And if they're getting taxed, like when is that money coming back, right? As a result of high reimbursement, right?
Yes. Good
how's
question.
That balance?
I made it sound very simple because I was trying to explain how you get a multiplier effect when you get the federal match. Right. But it can be controversial on the state level because when states want to do this, they generally do it in cooperation with the nursing home associations. But there's a big formula, a complicated formula that's behind all this. And there'll be some nursing homes that win and some can lose. There's a lot of formula that has to be satisfied in order for CMS to sign off on each and every one of these. So some nursing homes will not benefit from it, but it's one of those things that the state associations will generally work with the state on because a lot of times your Medicaid rate, it just doesn't creep up fast enough to keep up with costs.
Right, exactly. Right.
You're stuck between a rock and a hard place. Do you engage with the state on a mechanism that's not going to help all your members, but it'll help many of them, or you just don't get an increase for the next couple of years? it can be a tough decision.
Yeah, yeah, gotcha. Yeah,
Yeah.
yeah. I see how that would be controversial, but net sum, it would be a good thing, right? So
Yeah, net, it's
yeah,
good. And states are, I mean, I think your readers know this, and your listeners, but states are very challenged with their Medicaid programs, which kind of leads into you asking me your next question, I
yeah,
think.
the bad stuff.
Yeah. The bad stuff.
So
So,
what's the negative? Mhm.
yeah, there's a lot of negatives in the bill. That is not beautiful, the kind of the other side. And when people say that, what they mean is they're referring generally to the totality of Medicaid reductions that are in the bill, in the law. And the totality is 1 trillion, $1 trillion over 10 years,
Yeah,
which is really a significant number.
yeah,
We're used to hundreds of millions in a cut, but that's mostly cuts to um, different parts of Medicaid, and it's not a direct hit on the part of Medicaid that serves nursing homes or beneficiaries that need nursing home care. There are cuts to other parts of the Medicaid program. For example, some states expanded their Medicaid program under the Affordable Care Act, which allowed them to serve populations in addition to Medicaid and give them a little extra help, and then they buy their own health insurance off the exchange, and that's called expansion populations. And the bill in general cuts way back on states that have done that kind of thing. And that's why you see these claims that this law will take eventually. I think it takes health insurance, not Medicaid, some Medicaid, but insurance away from about, I think it's between 10 and 11 million people when it's all said and done.
wow.
And there's work requirements for people on Medicaid. You hear about that. That is included in the law. That will not touch senior populations that are needing home and community-based care or nursing home care. So could any of that bad stuff touch our sector? The
Yeah,
way it could, it would be in an indirect way, is the way I'm explaining it. And what I mean by that is going back to the comment I just made that states are challenged to fund their Medicaid programs. They do get federal money, but they have to put up state money too. And
right.
often within a state's budget, Medicaid, corrections, the prison system in the state, and the education funds, those are generally, and there's exceptions, but those are generally the top three budget drivers in a state budget. So Medicaid's costing them a lot of money. So if they're going to lose and not every state loses the same amount of Medicaid money, but if they're going to lose some of that federal match, 1 trillion over 10 years, that state has to make a decision whether they're going to backfill the federal reduction with more state money or just not do whatever that, cut
Mhm.
back. Maybe they're going to cut provider rates back or cut optional benefits. They'll shrink their state program a
Mhm.
bit. They have to make that decision. And that kind of activity could have a reverberation on how much the state needs to put in their nursing home reimbursement pot,
Right.
or their home and community-based care pot. Maybe they've lost money on what they spend on moms and children. And so but they want to backfill that. So they're going to pull a little bit away from nursing homes.
Mhm.
Not set in stone. It's the way each state is going to react to less federal dollars coming into their Medicaid program over the next 10 years. So it's indirect
Right.
and might not be felt in every state, but there'll be a little something in every
Yeah.
state.
Mhm. Do you anticipate, yeah, and that makes a lot of sense. Thank you for that overview. And it's 10 years, right? But do you anticipate, when certain states might start, cutting back, right?
Yeah.
We're gonna start feeling it like next year and a couple of years from now, right? And what should
In some
providers be
ways,
doing to start getting ready to be more proactive?
yes, because proactivity will be necessary. In some ways, it could be a couple of years, but in some ways, it's going to be now. For example, Commonwealth of Virginia is already discussing whether their General Assembly needs to call a special session this fall, because they normally don't meet again until next January. Do they need to call a special session this fall to start thinking about what the impact of Virginia is, to get ahead of what their budget's going to look like for 2026? So some states are going to be proactive. If a state did a lot of activity to expand in their state under the Affordable Care Act, if they went beyond Medicaid and said, okay, it's this group of people, they're not as poor as our Medicaid population, they're just a little, they have a few more assets, but we're going to make it, we're going to give them a little funds so that they can buy their own health insurance and we can keep them off Medicaid. Well, states that undertook those expansion activities, they are actually hurt the most in the bill, because the bill was a reaction to states expanding under the Affordable Care Act. The law sought to maybe penalize those states more than others. So those states are going to need to do more planning, and you might see those states more active in it sooner, trying to see what the impact's going to be and what laws they may need to change. Nursing home advocates, and I keep talking about nursing home, but senior living advocates, home and
Assisted
community-based
living.
care, assisted living, our greater senior living sector are going to have to be watching their state assemblies, watching their key healthcare committees, or what their state Medicaid, what cues their state Medicaid agency might start making and talking about, because we're going to need to protect our turf, right? We've got to protect the services and the funding that's already going to the people we serve. We can't let it erode. So it will
Absolutely.
take proactive
Yeah.
advocacy to kind of get back to your question.
That's great. No, that's great to hear. I think that's going to be much needed. And outside of the threats that we're seeing on this latest bill that was passed in Congress, the one big beautiful bill, what are areas
Yeah.
on the regulatory
Sure.
regulatory scene are you focusing on, that you see as pending challenges that you will be focusing on your advocacy on?
Sure. And I was talking about different modes right now. So that
Yeah.
we just spent a lot of time on one big mode, kind of moving
Mhm.
out of enactment of that bill, the One Big Beautiful Bill Act, and now
Mhm.
moving into implementation. Another mode is the physician fee schedule, the Medicare Part B payment. We've had the proposed rule now released, and the headline is good. 3.3% increase to the conversion factor. That's partially due to that 2.5% good win that was in the big
Right.
beautiful bill. And then there was a couple little updates that CMS gave us. So robust, healthy increase to the conversion factor, which is great. But now we're diving into the CPT codes that I'll just use therapy as an example, that
Yes.
therapy mostly bills. And we look at the three components, the practice expense, the work, and the malpractice insurance, the three
Right.
RVUs. And preliminary results is the practice expense values are not looking good. And this is preliminary. We'll have a little more in depth soon. But despite that 3.3 increase that should rise all boats, there's some kind of cut driving a downward direction in this the practice expense of the CPT codes. And so
Therapy specific CPT codes.
yes, our therapy ones. And
Mhm.
the practice expense, as I said, is just one of three parts, but it's not, in other words, we're not seeing a direct correlation of
Right.
3.3% conversion factor increase. So, shouldn't all our codes be up
Mhm.
3.3%? It doesn't work like that in any given year, because when you get to the CPT code level, CMS changes them every year. Bits of ups and bits of downs, increases and decreases in those code values. CMS gets recommendations from AMA, and then they kind of do their own little magic on those codes. But this is looking like the fifth or maybe sixth straight year of a practice expense decrease as part of the overall CPT code, which we're very concerned about. We haven't figured out yet why, and we're not
I was just
100% that we're accurate yet. I hope I'm
okay.
wrong. We hope I'm wrong, but it's not looking that way.
Yeah.
So that's not good news for our
Right.
therapy, our Part B rehab therapy sector, because we've been
Yeah.
hit very hard.
For years. I
Yes,
mean, for years and years,
for
right?
years.
Yeah.
Yeah, and
Going.
it's, I don't think this is quite a signal from CMS. I don't think they
Mhm.
even think about it really, but
Yeah.
that's where this advocacy comes in. Like, hey, wait, CMS. This
Right.
is this is the impact to our codes. You're
Mhm.
you're get you're moving us to a point where we can't even afford to pay for that therapist
Right.
to provide that service.
Yeah.
So
Yeah.
we're now moving into a mode of extreme advocacy on this Part B. It's not just ADVION. We join up with other therapy organizations because we have a bigger voice when
Mhm.
we coalition, especially on this. So
Sure.
that's a big issue right now, trying to figure that out.
Yeah.
Uh,
Yeah.
yes.
Well, if you tell them to, keep the practice expense RVU down, but do away with MPPR, then we'll
Yeah,
be in a good spot.
we'd be in a good spot. That's unfortunately that was put into statute by Congress, so we have to, it's a law.
Yeah.
That is still in our sights. In
Yeah.
fact, the fee schedule proposed rule has a little an efficiency adjustment in it, and we're going to
Mhm.
argue that that's a duplicative of this MPPR. So
That
CMS, you
makes
got to
sense.
back off that for therapy.
Yeah.
I think
Yeah.
that'll be compelling.
That
There's
makes
kind of a
sense.
third mode. You want me to go into a third one, or did you want to move
Yeah,
on?
absolutely. Yeah.
Okay.
Yeah.
The third
Go for it.
one is telehealth.
I was just gonna ask you about
Were you
telehealth.
going there?
Perfect.
Okay,
Yeah, yeah.
excellent.
Great minds think alike, you see.
Okay. So kind of current state right now is that Congress has given us our latest extension to September 30. So therapists have authority from Congress through September 30th of this year to utilize telehealth in providing a service. Congress has a role in this whole telehealth thing. Congress has a role and CMS has a role. CMS's role is to approve which codes can be utilized in telehealth for therapists and other practitioners. Congress's role, it's because it's in statute, which practitioners can use telehealth. So that's why we need both entities to approve things. And it's could be a little bumpy road because the telehealth extension for September 30 is part of other policies that we call extenders. One of them is the gypsy floor, the 1.0 floor that we need extended. But those two policies, among a couple other extenders, were put into law with the government funding bill. So now those policies are tied to government funding. Government funding expires September 30. All these policies expire September 30. So we need the government funded beyond September
Which
30.
is
So,
around the
right.
corner. I
So
mean, it's yeah,
Congress just went home this week. We're talking here, we're
yeah,
almost August. Congress has gone home. They won't come back till right after Labor Day. And it's a quick journey between Labor Day and
yeah,
September
yeah.
30. We're
Mm,
already seeing some glimmerings of arguing over government funding. And so I want to caution people, we'll know more as each day passes, of course. But if we get into a shutdown situation where Congress waits a week after
yeah,
September 30 before they get everything together and fund, that authority will end midnight September 30. So we're, of course, ramping up our advocacy, but there are greater, larger politics involved here
sure.
with arguments over government funding. At the end of
Yeah,
the day, they will extend the government funding. We will not shut down for years or anything like that.
right.
But is it an hour? Is it a day? Is it not at all?
Mhm.
Unknown at this time until each day we get closer and we hear more rhetoric, more talking about what the plan will be and how both parties might come together.
Yeah, that's a big one, right? That's a big one.
That's a
I
very
mean,
big
I know
one.
that a lot of therapy providers are using telehealth, to treat patients, to see patients, and not just deal with the rural issue, right? Problem, where
Yes.
they can't find we just can't find therapists.
Can't find therapists.
We can't find therapists in LA and New York City, right? Right?
Yes.
It's not a rural problem anymore,
It's
right?
not a
It's
rural thing.
like
It's an access, right?
it's an access thing, right? And shutting that down is just would be painful. So
Very
we need the
painful and
advocacy. Yeah.
agreed. We need the advocacy. So we've carried that voice, and
Yes.
Congress has heard loud and clear that providers are almost disgusted with the uncertainty around this policy.
Yeah.
They get it. And that's why I
Mhm.
kind of said there are greater politics involved here, but
Right.
we're still,
Right.
subject to it.
Yeah. Yeah. Absolutely. Well, I know that we're coming here, towards the end of the conversation, and I think this, this was really helpful to understand, what are the issues that you're dealing with, right? With Avion to advance, the industry, on therapy side and also skilled nursing assisted living, all of that, right?
Yes.
Senior care in general. If you were to give advice, to an organization, right, whether it's a therapy provider or, or again, an institution or a health IT company, to get involved with advocacy, what's your recommendation? Obviously, the more people advocate, for this industry, the further we're gonna get along with some of the things that we're pushing for, right? So
Yes.
how can they get involved?
Yeah. Love that question. And I'll start small and kind of build a little. Just looking at rehab therapy, OT, speech as part of the Medicare fee schedule. We're I think we're about at 8-9 billion spend of the fee schedule. I think the fee schedule is 20 some billion a year spend. In some ways, that's a considerable amount.
Yeah, I thought it was gonna be lower actually,
Yeah,
Michael.
you would think it'd be lower. But in other ways, because we're not a physician specialty, we don't quite get the whole cred, as part of the House of Medicine, as part of AMA. So we therapy, and I'm thinking just therapy at the moment, but I'll bridge. We therapy have really got to amplify our voice. So I encourage companies to keep an eye, keep a foot, keep a person, keep an army, open to the advocacy requests that maybe ADVION is making. But even more than that, be active in the process. Submit a letter of comments to the physician fee schedule or the Part A rule. That's advocacy. You can tell them about what's going on in your individual company, how those codes impact you. So there's many ways to be involved. You can also answer the call when ADVION organizes certain email campaigns. A company can spread those around to their employees' families, friends. It's all it is a link that we share, and anyone's eligible to use that link to send an email to their member of Congress. If you just put your zip code in, it tells you who your member of Congress and who your two senators are. So you don't even have to
Very
know
easy.
who they are. It's
Very
that
easy.
easy. Sometimes volume in terms of those emails is effective. Sometimes an email that really just tells a very unique story, and all of our emails, you can customize them. That can be
Yes.
just as effective. And I'm giving you different ways companies can be involved
Yeah.
because if we're not involved, if we're not having our voice up there, if we're not telling members of Congress what our pain points are and how they can solve them, they don't even know we exist.
Okay.
That old adage, if you're not at the table, you're on the menu kind of thing. But another way that some people have undertaken, they actually come to DC at our March conference. Sometimes we do it in other times of the year where ADVION sets up meetings for you with your member of Congress or a staffer, and we'll help you with the talking points and train you and let you go one-on-one, and we'll be there with you on the call and talk directly to that staffer. Because at the end of the day, I might be a professional lobbyist, but my voice is not as important. What's important is to that member of Congress is the constituent, because that
That's right.
constituent is voting them back in the office, right? And
That's
they
right.
want to keep being in office. They want to keep running for Congress and keep being
Right.
successful. So
Yeah.
it's the ideal is if when our advocates kind of form a relationship with that staffer. Maybe they meet them on a Zoom call, and you're not having to be best buddies, but maybe you ship them an email once or twice a year once you get their email address and say, hey, the fee schedule just came out and my company's seeing this decrease.
Yeah.
And we have to close up shop
Mhm.
actually in a couple of
Yeah.
locations. We can't afford
Mhm.
to serve
Right.
those areas anymore. That's
Yeah.
all it takes. It's,
Yeah.
and so those are some different
That's
ways
great. Mhm.
that you can be an advocate.
Yeah. Yeah.
And you can do it
And
right from your armchair, right from your
that's
home
right. That's
office or
right.
your
Yeah. You
office.
don't have to go to the conference or stuff
No.
like that. Right. One of the things that I really love about some of the members of Advion on the provider side, and then also on the health IT side, but first on the provider side is that they are finding ways to put a process within their organizations around advocacy, right?
Yes.
So they might have somebody in charge, maybe it's in compliance, right, for advocacy efforts and making sure that they understand, let's say, what organizations like Advion are lobbying for, for our industry. And then they pass the message along to other executives, in the organization and also to the providers that are on the floor, providing care for the patients. Because to your point, right, like if a therapist, right, can actually they can get in touch with their congressman as well, right?
Absolutely.
And say, hey, I'm getting caught up access, right? From seeing this patient, post stroke, and I cannot get him into the clinic until like 3 weeks later after a stroke because I don't have telehealth, right?
Yeah.
And
Yes.
here's the circumstance with this particular patient, right? Obviously, without mentioning any names,
Names.
but I mean I think that's pretty powerful, right? When an organization that's providing care to thousands of patients can systematize, can good process around advocacy. I think it's a beautiful thing. But I
It
think
really is.
organizations like Advion make it a lot easier for companies to be able to do that.
Yes, we're encouraging that. One
Mhm.
way we are making it
Yeah.
easier is we've been running a program. I think we're on our ninth year. It's called Emerging Leaders, and
Yes, I
all of
love
our
it. I love
members,
that program. Yeah.
yeah, all of
Mhm.
our
Yeah.
members can have two
Yeah.
people go through it each
Mhm.
year if they wish, completely
Yeah.
part of the
Mhm.
membership, no extra fee, and
Mhm.
it's a deeper dive in how to be an
Yeah.
advocate. What is
Mhm.
this fee schedule? When does it come out?
Yeah.
How can I get ahead of when Avion knows it's coming out? How can I know when it's coming out for my own
Mhm.
company, so I can help my company be ready for it? How can I make a deeper dive into the infographics or the materials that we're using to educate the Hill? In fact,
Right.
the class this year felt like they wanted to add to educate more frontline therapists, so not even Congress,
There you go. There you
frontline
go. Yeah. Mhm.
therapists
Mhm.
on the impact of the fee schedule. It's not just the therapy company changing this, saying, oh, there's another reduction. This is coming from CMS and helping them understand that scenario, which I
That's
think
right.
is really kind of
Yeah.
exciting.
Yeah, emerging program is a good program. We actually have, one of our own, Deb Winterfloor is actually
Yes,
a
Deb.
part of that program this year, so I can attest that it's a great program. But if just last question, if people want to find out about Advion, how to find you, how to learn,
Sure.
how to advocate, where do they find you?
Sure. We're on the web, www.advionadvocates.org. We're also pretty prolific on LinkedIn. You can find us on our LinkedIn page under Advion. We do a lot of posting of the memos. Some of the memos we put out, we'll post. But you can email me. I'm Cynthia at advionadvocates.org. And I'm always available and love to talk to anybody who wants to know more about Advion, how to be involved. We are looking for new members at this point. We're really looking to increase our numbers so that we can amplify our voice. Therapy, especially therapy, it's a bit under siege now, and so we're really looking to increase our ranks. So if you're wanting to be more involved or really just get our updates, I'd love to talk to you.
Well, Cynthia, thank you so much for your time today and for taking the time to share your knowledge, your expertise, and thank you again for all the great work that you do for our profession and for all the patients that that we serve or that our industry serves. And it's really important work that you guys do. So thank you so much,
Thank you,
and
Louis. It's
thanks
been a
again for
great
taking the
day,
time.
and thank
Mhm.
you for being
Yeah,
active. And I appreciate
yeah,
our time together today.
yeah. All right, Cynthia.
Okay.